Living with borderline personality disorder can feel like you're trying to navigate a constant storm of really intense emotions. And if you're someone who cares about a person with BPD, it can be just as confusing. But what if there was a map, a clear path through that storm? Well, in this explainer, we're going to do just that. We'll break down what BPD really is, we'll demystify the journey to treatment, and we'll equip you with a powerful toolkit for building a life that feels more stable and honestly more fulfilling. So let's get into it. All right, so here's our game plan. First, we're going to get a handle on what BPD actually is. Then, we'll look at the steps to getting effective treatment. We are absolutely going to dive into the gold standard therapy, which is called DBT. After that, we'll build your personal coping toolkit with skills you can use every single day. And finally, we'll pull it all together to look at what building a stable life really looks like. Okay, first things first, we have to build a solid foundation here. Really understanding what BPD is, and just as importantly what it isn't, is without a doubt the most critical first step on this entire journey. So let's just ask the big question right up front. When you look past the clinical label, what is it actually like to live with this condition? How does it really shape a person's world, their thoughts and their connections with other people? So at its very core, BPD is all about instability. And we're not just talking about mood swings. This is a condition that really affects the fundamental way a person sees themselves and how they connect with the world around them. And as you can imagine, this can make everyday life feel incredibly unpredictable and, frankly, pretty chaotic. Now, what's so important to understand is how BPD gets diagnosed. A professional is looking for a consistent pattern of behavior, and to get a diagnosis, a person has to show at least 5 of these 9 specific symptoms. This is exactly why BPD can look so different from one person to the next. It's really a spectrum of challenges, from this huge, overwhelming fear of being left alone to a deep struggle with having a stable sense of who you even are. And listen, this is not some rare, obscure condition. We're talking about an estimated 1.6% of the US population. That translates to millions and millions of people. And it's really important to remember that number is probably on the low side because BPD is so often misdiagnosed as something else, like bipolar disorder or major depression. Okay, so after all of that, here is the most important thing to hear. BPD is definitely challenging, but it is absolutely treatable. So let's talk about how that journey toward healing and stability actually begins. Because recovery isn't just a possibility, it's the expectation. So the path to getting real help starts with a clear diagnosis. And this isn't some scary, mysterious thing. A good mental health professional won't just make a snap judgment. It's actually a really thorough, careful process. It involves a detailed interview, a psychological evaluation, and a medical exam just to be sure nothing else is causing the symptoms. Now, when it comes to treatment, you have to understand the different roles that therapy and medication play. Think of it like this. Psychotherapy, or talk therapy, is the main event. It's the absolute cornerstone where you build the actual skills to manage BPD. Medication, on the other hand, plays a supporting role. It can't cure BPD, but it can be a huge help in managing other issues that often come along for the ride, like depression or anxiety. All right, so if psychotherapy is the main event, then dialectical behavior therapy, or DBT, is the headline act. Right now, it's the treatment with the most scientific evidence behind it, and it was designed specifically to treat BPD. It's a real game changer. So what on earth is DBT? Well, the magic is right there in the name. Dialectical just means bringing together two opposites. DBT brilliantly balances two ideas that sound like they can't exist together. One, accepting yourself and your reality exactly as they are in this moment, and 2, the need to change behaviors that aren't working so you can build a better future. It's all about creating a life that genuinely feels worth living. And DBT isn't just sitting in a room talking for an hour a week. No, it's a whole support system. You've got a skills group where you learn new strategies, individual therapy to figure out how to apply those skills to your specific challenges, phone coaching for in-the-moment support during a crisis, and even a team for the therapists themselves to make sure they're providing the best care possible. It's really comprehensive. Think of these as the 4 superpowers that DBT teaches you. Each one directly targets a core difficulty of BPD. Mindfulness brings you back to the present moment. Distress tolerance gives you the tools to get through a crisis without making things worse. Emotion regulation helps you understand and gain control over those intense feelings. And interpersonal effectiveness teaches you how to get what you need while keeping your relationship strong. Okay, enough with the theory. Let's get our hands dirty.
we're going to start stocking your personal coping toolkit right now with strategies you can actually use to manage those tough moments in everyday life.
Okay, this is your blueprint for taking back control from emotional triggers. First, you have to figure out what sets you off. A journal is amazing for this. Then, you try to understand why it affects you. Now, here's the key, and this is so important. You build and practice your coping skills before a crisis hits, when you're calm. It's like a fire drill for your emotions. From there, you learn to communicate your needs and create a specific plan for when a trigger shows up.
When you feel overwhelmed, like your mind is spinning out of control, grounding techniques are your emergency brake. They pull you out of your head and stick you right back into the present moment by using your senses. You can just quickly name 5 things you see, 4 things you hear, 3 things you can touch. Or a great tip is to use a strong scent. Even something like hand sanitizer can be powerful enough to snap you back. And never, ever underestimate the power of just breathing. The 4-7-8 method is simple. Breathe in for 4, hold for 7, and breathe out for 8.
So what happens when you're already in the middle of a crisis? That's where distress tolerance comes in. These skills are all about surviving emotional pain without doing something that makes it worse. You have options. You can self-soothe with comforting things like a warm shower or a soft blanket. You can distract your brain with a totally different activity. Or you can fight an unhealthy urge by doing the exact opposite. If you want to isolate, you reach out to someone. And the foundation for all of this is radical acceptance. Just acknowledging reality for what it is, not what you wish it was. That is the first step to reducing the suffering. Whew, we have covered a lot of ground, from really understanding the problem to exploring some incredibly powerful solutions. So now, let's bring it all together and focus on the hopeful, long-term vision, building a stable, meaningful life. And if you take away just one single thing from all of this, please let it be this. Recovery is a process. It's a journey. It takes time. It takes practice. There are going to be good days and there are going to be bad days. But with the right treatment, with a real commitment to practicing these skills, and with a whole lot of kindness for yourself, it is completely 100% possible to feel better, to manage your symptoms, and to create a life that feels more stable and genuinely fulfilling. So I'm going to leave you with a question, and no pressure here. Just forget about trying to solve everything all at once. What is one small, manageable step you can take today, right now? Maybe it's just looking up an article. Maybe it's trying one of those breathing exercises. Or hey, maybe it's just giving yourself credit for watching this in the first place. Whatever it is, that one small step, that's where the journey to a better future always begins.